There are two kinds of dopamine firing. The first one is what we call the tonic dopamine release. Tonic dopamine release activates predominantly the D2 receptors, right? The inhibitory. Tonic dopamine is what keeps us going. So in other words, if I give you an example, in Parkinson's disease, it's the striatal D2 dopamine receptors that are basically degenerating. If you think of it, if there's not a lot of dopamine in that striatal area, what happens is bradykinesia, bradyphrenia, which is what we really see in Parkinson's or Parkinsonian side effects in some case. Now, tonic dopamine release is essentially you need a single spike, and a single spike just a plateau and down. This is how we function. This is the non-substance use or non-euphoric dopamine release, dopamine pattern. And this is adaptive because tonic dopamine release ensures adequate motivation. It ensures adequate reward, not too much. And we'll see the Goldilocks effect comes in here. The second type of firing is the phasic or the burst firing. Now, this burst firing stimulates the D1 receptors. Why does it do that? You see, D2 receptors require they get easily stimulated. D3 even easier, right? So D2 receptors are very easily stimulated by dopamine. You know, if dopamine is circulating, D2 receptors will be stimulated. D1 receptors, on the other hand, require extremely high extracellular levels of dopamine to be stimulated. And this is the reason, and note they're in the prefrontal cortex, this is the reason why in certain individuals we require significantly higher extracellular levels of dopamine to stimulate the D1 receptor. And that's the reason why we have this whole group of medications that we call psychostimulants, right? But we'll see, what does a stimulant mean tomorrow? When we go into the detail, we'll see that they are essentially agents that give us, you know, quite a bit of flexibility in targeting the noradrenergic and dopaminergic system. And when we use them properly, there is absolutely, you know, a huge potential to improve lives, but at the same time, minimize side effects and improve tolerability. So burst firing is required to stimulate those D1 receptors. But here's the thing, we can't function on continuous phasic firing. It's not adaptive because it mimics, and we'll see later, this is the phasic surges, because it mimics a substance use type or impulse type pattern. And that's not how we function. We want to move towards a tonic. This is going to be important when we choose the medication, and this is why we have long-acting and immediate release agents, and we've got to think about how we use it and what the patient tells us. So we will see later when patients say, "Doctor, I don't feel that the medication's working," versus a patient saying, "I found that I'm not able to engage in this task for an adequate period of time." These two statements are so different because you will notice that when patients tell you, "I don't feel XYZ," you see, stimulants or ADHD treatment isn't about feeling because we're not meant to feel phasic bursts all the time. It's not adaptive. We're meant to move towards the activity dimensions. And that's a core part of psychosocial rehabilitation, psychology, and of course, adaptive functioning. Particularly important in adolescents and younger adults, I find looking at their routine becomes important. And this is a psychoeducation I will often go through, is that the aim isn't for you to feel great or really happy for a certain period of time. It's not about happiness. It's about moving towards those initial reward and motivation. And that requires action. Just to clarify something important here, of course, it's important that we improve mood. So when I talk about happiness and feeling, we're looking at focusing on action and motivation because sometimes focusing on only the feeling aspect might be transient. And that's really what we're looking at. If a person's depressed, of course, we've got to work on that low mood, improving motivation and the ability to experience pleasure. The principle really here is that when an individual's reward sensitivity improves and they're able to experience greater reward, i.e. anhedonia reduces,
when their activity improves, which means their motivation improves, then they're able to engage in tasks better, and that reward that they receive from it improves mood secondarily. What I'm trying to highlight through the feeling and the happiness aspect is more that if they evaluate, or we evaluate, a stimulant or ADHD treatment purely based on how they feel, then sometimes we might miss the bigger picture of what the actual aim of ADHD treatment is. From a longer term perspective, it's about activity, goals, and that's where psychosocial rehabilitation comes in.